Hello there. Welcome to this day's presentation. This is about blood pressure and the Addison disease in dogs. The adrenal glands are located at the anterior end of each kidney. So you and dog and the cats have two adrenal glands because you have two kidneys. The adrenal glands produce two steroid hormones that regulate the blood pressure. These are cortisol and aldosterone. Cortisol is a glucocorticoid hormone that regulates the glucose metabolism in each and every cell in the body. In other words, cortisol ensures each cell in the body has adequate energy to carry out all its functions. Aldosterone is a mineralocorticoid hormone that regulates blood volume and pressure. Addison does this by optimizing the reabsorption of sodium and chloride ions and the excretion of potassium and hydrogen ions in the kidneys. Aldosterone does the same thing in the colon. The absorption of sodium chloride ions, excretion of potassium and hydrogen ions in the colon. This movement of salt or sodium chloride is followed by movement of water. In other words, where salt goes, water follows too. Where salt goes, water goes too. And diuretic hormone, or ADH, or vasopressin, is the other hormone that is involved in the maintenance of blood volume and pressure. And diuretic hormone facilitates the reabsorption of water from the kidneys. Alright? And diuretic hormone does not facilitate the reabsorption of sodium and the chloride ions. And diuretic hormone only facilitates the reabsorption of water only. The absorption of water only. And diuretic hormone is secreted in the posterior lobe of the pituitary gland. What has Addison disease got to do with the cortisol and the aldosterone hormones? Addison disease describes hypoadrenocortism, or deficiency of adrenal hormones, namely cortisol and aldosterone. Addison disease is believed to be caused by an autoimmune reaction that destroys the adrenal glands tissue. In the previous video, I discussed Cushing's disease or hypoadrenocortism with the emphasis on elevated cortisol levels. The signs of Cushing's disease are signs of elevated blood sugar. The signs of Cushing's disease, as I described in the last video, you have the image still, this dog with the dog with Cushing's, are signs of elevated blood sugar. Those signs, as I discussed them earlier, are the same: hair loss, alopecia, pot-bellied appearance, increased appetite, drinking and urination, thin and easily bruised skin, diabetes and obesity, lack of energy, difficult walking, and seizures. The clinical signs of Addison disease are the signs of low blood sugar, low blood sugar, low sodium and elevated potassium. Signs of Addison disease: signs of low blood sugar, low sodium and elevated potassium. These signs could be depression, could be anorexia, vomiting and diarrhea. The dog may have polyuria and polydipsia or increased gas and increased urination because it is losing sodium and potassium through the kidneys. It might have a weak pulse, irregular heartbeat because of the increased potassium ions. The dog may be dehydrated too. How is Addison's disease diagnosed? Your veterinarian, you do a complete physical examination of your dog. Your veterinarian, you do a complete blood work looking for low sodium levels or hyponatremia and the high potassium levels or hyperkalemia. If the blood work results are not confirmatory of Addison's disease, your veterinarian may perform adrenocorticotropic hormone at the cortisol stimulation test to confirm low levels of cortisol. Adrenocorticotropic hormone and the cortisol stimulation test will confirm low levels of cortisol. How is Addison's disease treated? Your veterinarian will determine what hormones, cortisol and aldosterone, that need to be replaced for the rest of the dog's life. And that's the end of the video. If you are happy with what you have watched, subscribe, share it, comment, or ask a question below. Thank you for watching and see you in the next video.